This summer, the U.S. has seen a rise in COVID-19 cases among adolescents. A recent study found that out of 465 patients aged 18 years or younger diagnosed with COVID-19, more than one quarter had one or more underlying conditions. Ryan Moran, MD, mile per hour, a pediatric intensivist at Pediatric Critical Care of South Florida, tells Verywell that the intensive care unit has seen an uptick in COVID-19 admissions and deaths among disabled children. The pediatric deaths we have encountered have involved children with a chronic condition or disability, Moran says. Of those children we admit to the pediatric intensive care unit, we see a noticeably higher proportion of children with a chronic condition. It is therefore very clear that children with disabilities are at much higher risk of acquiring severe disease. Last week, as schools reopened across the country, the Centers for Disease Control and Prevention, CDC, reported a sharp rise in COVID-19 hospital admissions for people under 17 years old. I think we have observed enough school districts where mask mandates were and were not implemented to see a clear difference in how schools have handled COVID outbreaks, and how the available children's hospitals have been stressed by these policy decisions, Moran says. Moran fears that if schools don't take precautions, it is very likely that children's hospitals will be overwhelmed to the point that they won't be able to look after all their patients. With universal mask wearing, the rate of spread is significantly blunted and will allow our hospitals to keep pace with the number of new infections needing care, he says. In fact, he's noticed an impact locally where school districts are enforcing mask mandates. As of right now, Broward and Miami school districts have chosen to continue mask mandates, and with quarantine policies also in place, we have seen minimal concerns for outbreaks, Moran says. He believes the policies have made a big difference in preventing the surrounding children's hospitals from becoming overwhelmed.